We use our arms and hands for almost everything we do, so it is no wonder that shoulder pain can be experienced by many of us at some point in our lives. Shoulder problems are very common and can have a variety of causes. Shoulder pain can gradually develop over time. You may feel pain here, but did you know that shoulder problems can also cause the rest of your arm to hurt as well? Often these pains are described as an ache while your arm is still, or a sharp pain with movement of the shoulder. Pain may be caused by the muscles around the shoulder, the ligaments which help stabilise the joint, or pain may even be due to the bones of the joint itself. You may have heard of the term torn rotator cuff. This can be quite common and refers to the group of muscles which help to move and stabilise our shoulder joints. A torn rotator cuff muscle may happen from an injury, but more commonly occurs from general wear and tear. If you have trouble lifting your arm, then this group of muscles may be to blame. Osteoarthritis is also common in the shoulder joint. This describes the cushion surfaces at the end of a bone becoming worn and happens very commonly as we age. Symptoms often include pain and stiffness around the shoulder joint, which is usually worse first thing in the morning. Due to the complexity of the shoulder and its close proximity to the neck and spine, pain in the shoulder can sometimes come from the neck. If this is the case, symptoms may be worse with sustained postures like sitting at a computer or on the couch, or with certain neck movements. Alongside the pain, you may also experience things such as pins and needles, numbness and pain in the arm and hand. One thing to look out for is severe pain which interrupts your sleep. If this occurs, it is important to visit your doctor, as it may be a sign of something more serious. The shoulder joint is a ball and socket joint, which means it's capable of moving in lots of different directions. In order to do this, the socket is naturally quite shallow, so there are lots of ligaments and muscles to keep the shoulder strong and stable. We use our arm continually throughout the day, and therefore there are several very common issues that can develop with the shoulder. Sudden injuries to the structures of the shoulder can occur with such things as falling onto an arm or shoulder, impact to the shoulder during contact sports, throwing or even lifting heavy items. In instances such as these, ligaments, tendons and cartilage around the shoulder joint can become strained or sometimes torn. These types of injuries are called soft tissue injuries and can cause irritation, swelling and pain around the shoulder, and sometimes locking or clicking with movement. In instances such as these, it's recommended to apply the Reiser principle. Rest the joint, limiting movement. Apply ice for 15 minutes every 2 hours to reduce swelling. Apply gentle compression, such as a compression bandage. Elevate the area above the heart to reduce the amount of pain and swelling, and refer by going to see your GP or physiotherapist for guidance and management. If there has been a sudden strong force to the shoulder which results in strong pain and reduced ability to move the shoulder joint, it may be possible that a bone has been fractured. You will always be referred on to a specialist doctor by your GP or physiotherapist if needed. For example, other assessments may be required, such as MRIs or X-rays. These are only used if a fracture is suspected. If the extent of your injury is unclear, or if further information is required in order to manage your rehabilitation. Another reason may be for a surgical opinion, if it is deemed necessary. With any type of shoulder problem, your GP will be able to guide you regarding the extent of your injury and the management that is required. A physiotherapist will also be important for your assessment and recovery in order to manage your healing and symptoms, gradually building up your strength and control and developing your function so you can successfully return to the activities that you love.